Dr. Craig Spencer, who's living in Manhattan, now in isolation after testing positive for Ebola. He's the first person with Ebola here in New York City.
All right, he left Guinea on October 14th. He came back to New York City a week ago today, and now his movements are being closely scrutinized. Where was he? Who did he interact with? His fiancée is also in quarantine at Bellevue Hospital. Let's take a look at the scene last night, shortly after his arrival, as the world was alerted to New York City's first case of Ebola, an Ebola patient right here.
Yeah, Mayor de Blasio says that the city followed clear and strong protocols to prevent Dr. Spencer's infection from spreading to anyone else. In fact, they held a big conference at the Javits Center this week for the health officials, which, you know, was more than they did in Texas in the beginning anyway.
We learned a few lessons perhaps from Texas. All right, let's go to Bellevue Hospital, where Dr. Spencer is being treated right now. Robert Moses is there. Good morning, Robert.
Greg and Rosanna, good morning to you. We had hoped this day would not come, but we knew that this being New York and this being a global city, we knew that it could come, and now that it's here, we're going to see how those preparations have gone. Let me tell you, Bellevue Hospital is crawling with police officers this morning. You'll see them walking behind me. Some yellow tape just went up. They put this tape up to protect all the reporters here lined up on First Avenue from the traffic that's coming north. And of course, inside, we can't lose sight of the fact that this doctor is fighting for his life. He's in intensive care here in isolation. And soon we're going to see if all the preparations that have been taking place will pay off. A police escort guided the ambulance carrying 33-year-old Dr. Craig Spencer from his apartment in Hamilton Heights to Bellevue Hospital. The doctor, who works at New York Presbyterian Columbia University Medical Center, returned to the U.S. from Guinea exactly a week ago. He was there working with the group Doctors Without Borders treating Ebola patients. On Tuesday, according to the city health commissioner, he started feeling tired. On Wednesday, he visited the High Line and rode the subway system. Since his return from Africa, we know that he's ridden the 1, A, and L trains.
He did not have a stage of disease that creates a risk of contagiousness on the subway. We consider that it is extremely unlikely, the probability being close to nil, that there would be any problem related to his taking the subway system.
Spencer visited a bowling alley Wednesday night in Williamsburg called The Gutter. Late yesterday morning, he developed a fever. That was when emergency medical workers clad in protective suits rushed him to the hospital.
There is no reason for New Yorkers to be alarmed. Ebola is an extremely hard disease to contract.
We told you that Dr. Spencer works here in the city as a physician at New York Presbyterian Columbia University Medical Center. Well, the hospital yesterday released a statement saying that he has not seen any patients since returning from Africa, so that is some good news. Also, we know that Dr. Spencer took an Uber taxi cab during his time here in New York City since his return from Africa, but in a statement again, the city says that the driver of that Uber taxi is not in any danger. That is the latest. Live from Bellevue this morning, Greg and Rosanna, back to you.